Good morning. Hi, I am Kim Conger, and I teach in the Political Science and Public Administration Department. I'm part of our Master's in Public Administration program that specifically focuses on social justice. And this morning, we are going to talk to a number of community members who are community organization members who have been, part of the TCP family for quite a while. I'm going to do some introductions here, and then I'm going to ask each one of them to start with a brief introduction of themselves and their organizations, and an opening statement on the importance of socially just community-based research from their perspective as community partners. We have Ashley Young with us, who's the Vice President of Policy and Strategic Initiatives for the Urban League of Greater Southwest Ohio. We have Dr. Curtis Webb with us, who's a senior researcher at Design Impact and the former project director and grad assistant here at the Cincinnati Project. We have Renee Mahaffey-Harris with us, who is the President and CEO of the Health Gap. We finally have Dr. Meredith Shockley-Smith, who is the Director of Community Strategies for Queens Village and Cradle Cincinnati. Can I ask the panelists if any of you need to be able to share the screen and present? I think Ashley does. Does anybody else?
Oh, no, I'm fine.
All right, that is good. Ashley, I'm actually going to have you go ahead and start to give us an introduction and tell us what you think about community engaged research.
Okay, so good morning, everyone. I am so excited to be here. I am too sad that we are not in person. Every year I look forward to the dynamic conversation that this symposium brings, and also the amazing lunch that we always have. So thank you all so much for the invitation. My name is Ashley Young. I'm Vice President of Policy and Strategic Initiatives at the Urban League of Greater Southwestern Ohio. My background is public health. I've been in the field for a while. I tell people I'm on this journey to really just better understand social determinants of health so that we can create thriving communities, particularly for our Black communities. At the Urban League, we're focused in on making sure that people are financially fit in all aspects. We're really trying to build Black wealth at the end of the day. We have a series of programs focused in on entrepreneurship, giving people job training skills. We have our Center for Social Justice focusing in on criminal justice and reforms. Did you want me to say answer the question now too?
Yeah, go ahead and do that.
Okay. So the question was, what's the importance of socially just community-based research from a community partner's perspective? And I think that this is really, really important. I think when I think about what this means and the importance of it to us as a community partner is really about working with institutions such as yourself and making sure that you all are leveraging your power and resources to make sure that community has the ability to lead with authority. I think oftentimes when approaching these relationships, that's not the case. And we know that it's very important, and especially to really build relationships and making sure that co-creation is happening. I think we have to value the importance of community context. And I think when partnering with community organizations, that's kind of the expertise that we're lending. And so it really takes that trust to make sure that it's a mutually benefiting experience, but at the end of the day, making sure that community is leading and deciding. I think oftentimes community partners, communities are brought into situations and they have no power and authority. And that's why we experience the situations that we're experiencing today. So it really is about power. And working with institutions, they have the opportunity to really create rules. They do. And so how do we make sure that we're creating equitable rules and making sure that we're having folks lead and decide? The last thing that I'll add to the importance of the feedback loop. Oftentimes when we're engaging community too, it's just a drop in and a drop out. And so when I think about socially just partnerships and things like that, that feedback loop is going to be essential to make sure that what we're working on as it's going back and, kind of being refined, that we have this two-way communication that allows information to flow both ways. Thank you.
Awesome. Thank you so much. Curtis, why don't you go ahead and introduce yourself and give us your opening statement.
Thank you. I couldn't unmute myself. Hello, everyone. I'm excited to be here with you all today. My name is Dr. Curtis Webb. former graduate of UC. I actually got my PhD in the sociology program, and I was actually really excited to be here today because I was formerly the graduate assistant and project coordinator for the Cincinnati Project. And so I've been here in this realm for a long time, so it's pretty nice, pretty dope to be on the other side. Currently, I am the senior researcher at Design Impact, a nonprofit social innovation firm here in the city of Cincinnati. We sort of look at social justice issues at the center of creativity, equity, and leadership. We oftentimes see ourselves as bridges between the community and the organizations that we oftentimes work with. We see ourselves as looking at problems and issues around inequities in sort of creative and through creative ways. And so I'm excited to be on this panel today because as Ashley spoke, I was like, wow, she's stealing my thunder already, but that means I'm in good company. And so I think I wrote down like 4 main things that I've been thinking about a lot as we talk about socially just community-based research. And to be honest, socially just community engagement, because I think the times we're living in, I'm just gonna be honest, that's sort of in vogue. It's in vogue to get community input, to get community insight, to get community feedback. And so I think 4 things came up for me in this sort of the approach and in the framing that I'll be talking from today as we have a conversation is one of the main things I think communities are asking is why am I always being researched? And I think I was inspired by this particular quote from the Chicago Beyond Equity series, which is, if you haven't read it, I definitely recommend reading it and getting into it. It's a guidebook for researchers, community, and funders around questions around why are we continuously researching community members over and over again. The second piece is around how are we thinking about research projects? So are we thinking of it from the community perspective? Are you coming to me and saying, from a deficit framing, so you're telling me all the things that's wrong, all the ways that I'm not doing right in my life? Or is it sort of an assets-based approach? So are you already affirming or trying to amplify my existing strengths? The third one is what Ashley mentioned, moving from community input to community power. That's another thing. People are tired of being quote unquote listened to, or tired of saying, hey, come to me and tell me a little bit more about your experiences. What does it mean if you're talking about my experiences, you're not gonna do anything about it? You're gonna talk to me this year and then talk to me in 2 years again about this program or that program, but not actually give me the power to be at the decision-making table. And so that's one thing I always say when I'm working with community partners or on behalf of community partners is people are tired of just being listened to, but they want to be able to make decisions about their own lives. And they're perfectly capable to do that because we're actually doing socially just community research. We understand that people are the experts of their own lives and not just our own experiences as quote unquote experts in academia, et cetera. Give us authority to tell other people how to live their lives or how they should best live their lives. And the final piece is a question that I pulled from the research guide that was put in the chat is, how are we holding funders and researchers accountable if research designs harm or don't work? I think that's something for us all to ponder. What happens when we do all these research projects with community and it goes nowhere? Or a question, being in the nonprofit realm now, a question I always ask, why are nonprofits existing forever? Isn't the goal to sort of, eliminate inequities, solve some inequities, or at least reduce inequities? We shouldn't be patting ourselves on the back if, as academic researchers, as nonprofits in different industries, if we're continuing to exist in the same communities, in the same capacities forever. So that's my opening statement. I'm so happy to be with you all.
Awesome. Thank you so much, Curtis. Renee, can you give us an opening statement and tell us a little bit about yourself?
Sure. Well, first of all, I thank you, Dr. Bates, for inviting me to be a part of this panel. I know Ashley Young very well, so I am really honored to be with her and Meredith and those folks who I actually know directly. And actually, I met Shanok yesterday on another panel. But so I guess my opening statement is that my background is a combination of political, philanthropic, banking, corporate, and community But at the core of who I am is how we empower individuals, and that means all individuals, to be a part of their own solution. And so when I think of research and socially justice research or social justice, it's, it's kind of leveling the playing field so that when we sit in a room together, we all have value, and that value is equal. It could be academic value, but the experience of the life lived is value. And so how we look at the value proposition between individuals in a room who are doctors, who are researchers, and then individuals who are mothers, fathers, grandmothers, grandfathers, aunties. So when we can level that playing field in the research and understand that this is a conversation that is intended to lead to addressing inequities and not just talking about them and writing a manuscript, which is important because I think the challenge in research is that the work that you do is so important, and because of the way the system is set up, you need to publish research, you need to publish your manuscripts, you need and so how we can marry those, and so that the community understands that this is kind of the process, so transparency in that process that then helps residents who are part of the research, and Ashley used the word co-create, which I think is so important. It's a co-creation that leads to that empowerment and belief that we are together working towards a common cause of reducing and removing and eliminating disparities and inequities. And so it's not easy. And so everyone is needed. So I think that the more individuals who are a part of research initiatives, projects, etc., the more they understand your whole process, believe it or not, is more important than kind of saying research should be socially and justice based. They want to be equal, right? We want to sit in a room together. And so I think that's the opportunity. And listening to each of you already and knowing the work of many of you, I think we can move the needle differently and set the table differently. I hate to use that expression, but everyone seems to want to use the table. So fine, we'll use the table. So let's think of the table differently. Let's think of the fact that a resident who is maybe not college educated or what have you is equal to you based on their experience, and it's not one or the other. It's how we work this way, how we work together. So that's my opening statement. I look forward to being a part of this conversation.
Great, thank you so much. I'm going to introduce now Meredith. Could you give us your opening statement and tell us a little bit about yourself?
Sure. Good morning. Wow, that's a big Meredith. Hello. So I am Dr. Shockley Smith. I always use Meredith. She already gave you what we do. I also am an assistant professor at UC Medical School, really focused on equity. My whole life is consumed by thinking about, talking about, celebrating, lifting Black women, to the efforts of closing the gap between Black babies dying at an alarming rate. So to do that, we centered Black women's voices. I mean, it was not a novel idea to think, let us ask them why they think there is a problem, then gather their solutions, and then implement them. That was the process. By that process, we saw rates go down because Black women are powerful, they know so much, and they just were excluded from the conversation, and that's often how research goes. Let me decide for you what I think is best for you, and then do it. Not an effective process. So I appreciate this conversation because it's just giving voice and visibility to the way in which research should be conducted. I think to answer the question that we were supposed to answer in the beginning, you ask the expert, the people who are going to benefit the most, and then you give shared power and do that work leveraging the power and resources that you have, and give them the power to be an expert. Also, to pay them to be an expert. Those folks come to the table with more information than you can begin to imagine, and it is worth money. So I think that's also a part of the just work. And they're also the most effective in keeping you accountable. So I need you to continue to do what you said you would do, and I need there to be policy in place that sustains the work. And if they're walking alongside you, they are most assuredly going to keep you accountable. So I'm excited about this conversation. Thank you for inviting me.
That's great. Thank you all so much. So I'm going to start out by asking a question that you guys have alluded, all of you have alluded to this to some degree, but maybe you can be a little more specific in your answers than that. The question is, what do researchers get wrong when we try to conduct community partnered research?
That they're the expert. Yeah, I mean, I think like we come into situations thinking that, we are the experts, we've had X amount of college experience, this experience, or what have you. But I think when you're coming into the community in that environment, titles leave at the door, they stop at the door, and you are entering in the community's environment. And so I think that, we've all said this, that it is that community is truly the experts. And so I think oftentimes researchers forget that they are not the experts once entering into the community space.
Anyone else? Oh, go ahead.
I'll add that coming from the university and working in the classroom and having all the academic language and then bringing that to the ground and conducting research in the community, there was a shift in language as well. So we write these articles and publish them in places where people don't read them, and we don't give accessible language. And so really needing to translate sometimes was one of the things that I had to start off doing. So that's a
I want to add to what Meredith just said, that the translation is so important. I think that sometimes in this notion of leaving the title at the door, I think is so important, because what ends up happening is the intent is there. I think the heart for anyone doing research, and specifically community-driven research, I think the heart is there. But really kind of removing the boundaries that don't make someone feel inferior because they don't have letters behind their name, they can't utilize the same words, and really letting the conversation being driven from the individuals that the research is intended to really inform kind of what needs to be done next is, I guess, one of the strategies. But I think both of you said that. I can't express enough. Like I look at myself, and first of all, I'm not a PhD doctor. I won't consider myself an academic researcher, but I'm in the room with many academic people. And so like usually the first thing I say is, you know what, tell me what you really want to accomplish. So, and if your goal is to improve the lives of the people that this research is intended to support, then we need to flip the script, and you need to be willing to give them the power. And when you do that, I bet you're going to reach your outcome better. You can then explain that we need to couch this in these terminologies when writing it up, but really we are following you. And that then, I think that's what we need to begin to do in those conversations, so that, it is hard to level set. So it doesn't matter if you leave your title at the door, they still know they're meeting with X academic institution, and so it's still, it's just human nature, right? Because they want to respect you because you've worked hard to get your degree and to have the knowledge. So they immediately believe that my knowledge is not equal to yours. And I always say to anyone that we're working with at the Health Gap is, I've just had more exposure than you. That's it. That's all. That's the difference. You have the same information. I just had more exposure and maybe have more nice words to put around it. So that's my thought.
Thank you. So then how do we think about then what those kinds of, flipping that idea of flipping the script, or what kinds of direct benefits do you think researchers in the university can give community organizations for participation in these kind of community partnered research beyond the research itself, right? I think most of us understand that we ask people questions, and like Meredith said, people need to be compensated for their time and their activities. So how do we maybe think about those kinds of direct benefits beyond just the research itself?
I can start, and oh no, go ahead.
Oh, no problem. Yeah, I can jump in. I think, well, to answer the last question too, I think a lot of I was gonna say researchers are doing a lot of things wrong. Um, but no, honestly, I think one of the things, thank you, Renee, for what you said, is one of the things that I've heard a lot from panelists is just the humility piece. I think that's a large part of what tends to be missing and I think that informs everything from the approach to how we do research to how, like I would snap my fingers when Meredith said paying people for their time and their expertise. And I think we oftentimes think that, hey, we want to do this research that's going to quote unquote benefit your life, and so you don't need to be paid for that. But time is valuable. Everyone's time is valuable. But I think one of the major things that I've been thinking about in this specific realm as well too is like, what do we actually need to act? And that's sort of what I'm asking of researchers from the community perspective is, what do you actually need to act? What do we actually need to improve? What Renee was mentioning about, like, to improve the outcomes on people's lives. Like, how is this research going to benefit people's everyday lives? How is this research going to benefit people's long-term lives, et cetera? And one thing that I've noticed a lot about too is that we oftentimes ask people to recreate and rediscuss trauma, and then don't give them the space, the opportunities outside of that to sort of deal with that trauma. So we ask, hey, come and tell us about your trauma so that we can go back and write about it and tell other important, quote unquote, important people in decision-making seats about it. But for me, it's like, I need some more material circumstances, both monetary and also programming, that allows people's actual life to change, not just something to say. Like, stories and narratives are powerful, are important. But for me, I think the stage that I'm at as it relates to like socially just community engaged research is like, what more? What more do we have to offer this? And that's why I love like Meredith's work. Like, I see Meredith everywhere and I love her work because she is one of those examples of moving beyond just talking to women about their experiences in Cincinnati. And so literally that translation piece is, I think, the key point for researchers to move from just doing research on community to doing research for and with community.
Excellent, thank you. Other comments?
I really appreciate what you just said. Thank you. I think some best practices that I have discovered that I really value are the community advisory board. So teaching people to be researchers. And so that's the premise that we use, and we keep them in community. So it's also helping to support each other. So I think that the notion of a village and walking together, learning together, staying together, so that when we come back in to do additional research, we have relationship. That trust piece, I think, is really important. And I'm going to shout out Dr. Carolette Norwood, who I know is on this call. We did some work as a CAB. I was on a CAB for her. And the education piece where she taught us to collect data of sensitive nature was really important. And I also think that turn back the information you got to the people you asked for their story, right? So can you share back what the point was of my talking and hashing out what have you, and then what's the impact, right? What is the impact of what I just shared? So I appreciate you for your exemplar work, Dr. Norwood.
Thank you. Ashley or Renee?
I guess all I was going to say is, as Meredith was talking, I know I haven't really described how we do research, and our research begins with assessments that we are training people on the reason that the survey is created and helping, and they are part of creating the survey. Even though we may create it, we walk through, here's what this survey is intended to do. Are there questions here that make sense for you based on what the goal is? Which the goal is to understand what everyone that lives around you wants to see and be available and have knowledge in to improve the lives of themselves and their families. And so when we start there, and then, you know, we've trained people on how to input the data into SPSS, right? Or to, you know, the work that we do. And then we've sat down as we're analyzing and analyzed it with the very people that we are jointly doing research with. And then when we present it, it's not us doing all the presentation, but they're part of building the presentation and sharing that information, because that's the most powerful, is when that translation can actually come from the very people that the research is intended to, I guess, inform their lives to address how we move the needle in improving, for me, health disparities or health inequities, or the disparity around length of life in a neighborhood. And so that's how the script gets flipped for us. So that, what I say, and Ashley has worked with us, our goal is to coach you. But we need some baseline information to inform where we go so that we know whether or not we hit our mark. And so that's how we move forward in research. We don't, I think we say we're utilizing a community-based participatory research approach or social just approach, but those words are important to us. They're not important to the people that we are working with and working for. So, yeah.
They said it all.
Okay. Well, I'm going to actually move us on to some questions that are being asked from people in the audience so that you guys can have those conversations too. So the first question that's asked is, how do we take information gained from research and then best disseminate it through the community, especially if our research is full of academia-based language? That actually talks to the questions that several of you were answering before.
Yeah. And I think Renee made this point, Meredith made this point too, just around the translation. And so Meredith, she talked about the advisory councils. Renee talked about that too. And I think like if you're in community and you have those trusted relationships, you're able to go to them and ask them, how can we translate this? Like how is this going to resonate with community people? And so I think being in those relationships and being able to share that information and have people help to translate is going to be important, and that's oftentimes the piece that's missing, is that it gets done, the information doesn't flow back to community, or if it flows back, it's not in a way that people are able to act upon and even comprehend sometimes. And so I think having a group of people that you're constantly in communication with and having that be an act for them to make sure that they are kind of reviewing information and stuff before it gets shared out.
Cosign. Also, I would add that the community advisory folks help you do that translation. And then social media is a beautiful thing. How do you bend that back? Can I give it to you in a meme? Can I give it to you in a video? Can I give it to you in a blog? I'm Reddit, you name it. So I think there's like so many new channels that we can take advantage of. And again, if you center the people you're serving, they will help you translate and communicate well with the people you're trying to reach. Again, experts are worth more than I can even begin to name.
I would like to add to what Meredith has said and really commend Meredith. And I'm going to push on a different direction here. When I think of the work that Meredith is doing and what's being done at the Urban League and other many organizations, and as well as your research, until we can start moving up the ladder and seeing value given to these approaches that are level set and that are about the voice coming from the very people that research is intended to improve, intended to impact. And that means, people at your C-suite in a system, people in your academic settings that are going to understand and value the voice of individuals in the community equally, so that your work becomes more of the roadmap to putting us out of business as nonprofits. So I think, I don't know the answer, but I hope out of the time that we're in right now, whereas I think Mr. Webb, I'm sorry, I didn't remember your first name, what you were saying early on, about the time we're in, I hope that a year or two from now that we have moved the needle differently, because the power is coming from where it needs to come, which is from the people whose lives are impacted. So anyway, that's not really responding, but I just wanted to kind of elevate the direction that both Ashley and Meredith were going, but take it to that next level, because that's what it's going to take for the change that we're talking about to happen.
So building off that idea of change that we want to see happen, the next question, I'm actually going to combine a few here. But how do you make a distinction between social justice research and social justice activism? And how does that play out in the academy and in the community? And I think the other part of this question then is, how do we prevent our research from just being a stalling tactic in terms of, let's do some research instead of digging in and fixing whatever, right? So I think that, yeah, so that's the question is sort of, do we make that distinction? How does that work? What do you all think?
Well, I'm gonna snag this one. This is so important. So the research for me was secondary. So we went in and asked the people, right? We get the expert piece. And then we collected data as we walked along. And what did that tell us about our process? Was there efficacy? Did it work out? If so, great. If not, why not? And then we're back to that research process of asking and changing. So, and so the idea of walking alongside or activists, I think the question in the chat from Christina was about what's the difference between solidarity and serving. And so I think when you walk in and you say, what do you want? And they're like, I would like to better understand how money is spent from, let's say, Medicaid on infant mortality. And so you bring women to the table, and then Medicaid says to these women, can you help me better spend this money so that it will impact infant mortality better? Now, that is shared power. When I say X people should be making Y people do not have an intervention that is solving the problem. And so I think and then the research comes alongside. Is it more effective if the people who are being served are able to categorize, organize, create interventions, et cetera? Now we have research that is run by the people, created in solidarity with the people, and we're moving forward together, that shared powered notion. And many of them are now all working in public health because they found space there to be at the actual table, at the leadership table, and also not trying to push people in the direction they don't necessarily want to go. So there's also this piece of like, if the community doesn't want to be a researcher, they just want to be a part of the research, that is also okay. So trying not to push our agenda is also a kind of a hiccup of research. And at the same time, making certain that we give people as much space to be who they want to be and need to be as part of success or growth.
I can jump in too. I think, and this question is great because it fired me up earlier, something Renee said, because I think the question I always ask is, what more do you need to act? I think as researchers, we have to ask ourselves, what's the point of the research? What extra value is this going to add? I find myself in a lot of situations in which groups, people, orgs, et cetera, are asking for research from the community for answers they already know. And I think as researchers, we have to be honest with ourselves about that and say, hey, we don't actually need research here. We actually just need to listen to the people who have been talking about these same issues probably before you got interested in it, to be honest. These same issues that different organizations, different groups, universities abroad are just now getting interested in. People have been dealing with these same issues every day and have been navigating them every day. And so instead of doing research for the sake of research, we have to ask ourselves, can we just listen to people? Can we just bring people to the table and say, advise us on how we need to change these policies or the way we interact with you or the way or the institutions we have on how we can change these. Research isn't always the goal, and research is my bread and butter. That's what I'm trained to do. But I know that research isn't always the goal, and it doesn't always necessarily add value in the way that we think it does. It doesn't, I know it checks off boxes for people. I know a lot of times people feel more certain when they have some sort of scientific quote unquote value behind it. But I think we need to move past this need for some study to tell us what we already know. We need to just trust people about their own perspectives. As we said, to do socially just research, to do this type of research, you need to value people as experts on their own lives. And so that means don't just do research studies on them, but ask them, what do you actually need? And let them make decisions about that. Give them power to do that as well.
Yeah, I'll add a think I'm over here like taking notes and guessing you, Dr. Webb, because I think what you said was spot on. And I think that, you know, leading with the social action activism is the right frame because it's leading from an action standpoint. And I think to Dr. Webb's point, like we get stuck in the research a lot and we don't move beyond that. And so I think framing it from that, what action is needed instead of what research is needed, then that might lead to a different type of research that's needed that's based in action.
I would add that it's not either or. I think sometimes we feel like it has to be either or. So the social justice activism and research and working with and empowering people with the tools to drive to the, I think someone put in here, the solution, a community-driven solution. I think, and here's this is not necessarily a quote, but this is paraphrase. So very often when we're going into a neighborhood, what they say to us is, okay, so how long is this going to happen? Like, when are you leaving? What's next? You know, because this is what they're used to in research. And I said, well, listen, I'm not going to be here forever. So I'm here to make sure that we can build some tools so that we can understand how to coach you and how you can be able to speak to the systems that are in your community that are not meeting the needs that you need met. And they don't trust that because it's like, that's not really how most people come to us. And I don't know how we change that paradigm. I don't know, because we have to. And so that's why I don't think that there's a separation from social justice activism. I think we have to figure out how we understand at this table, or that there are many facets, and no one believes that the research is going to lead to solutions in community. I'm not going to say, I can't say that for everyone, but I think that's the perception. And so I think the things that Meredith is doing, I think, changes the perception. I think the things that we're doing change the perception, because I'm like, you're going to make me accountable, but I also need you to be accountable, that you're going to sustain, and that we're going to make sure we know the tools you need, or that you understand how to ask for what you need, and how to ask that system, be it a hospital system, not necessarily a hospital system, but be it, an educational institution, like how you participate in the PTA or PTO, how you advocate for your child, and understand that system. So I don't know. I think that it is both. It's yes and. But I think a lot of the processes are going to have to change in how we talk with our community that we are co-creating solutions with.
Thank you. I'm going to ask one more audience question. And so for some of you who have questions on here that I'm not getting to in this session, some of them will work great in the next session as well. So keep thinking about them, keep asking them. So the question that I have from the audience is, how do you approach conducting research in partnership with agencies, with organizations that are embedded in larger systems that are inherently broken, complex, or corrupt? Especially when the issues you're trying to address are emerging from that larger system. So I guess it's both how do you deal with this, and how do you, what advice would you give to other kinds of community engaged researchers who want to deal with these kinds of problems?
I'm sorry, can you repeat that one time more time?
Sure, sorry, I asked like a 4-sentence question there. So the real question is, how do you approach conducting research in partnerships with agencies that are embedded in larger systems that are inherently broken or corrupt?
I can start.
Yeah, go ahead.
Yeah, I can start us off. I think for me, one of the things that always come up when we're trying to operate around sort of these larger inherent institutions that create inequities themselves is to actually bring those people to the table. Like, I think we need to flip the researcher lens, if you will, from saying, hey, how can you stop this institution from upholding white supremacy, and actually ask the institution, oh, how can you stop perpetuating capitalistic and white supremacy tendencies? I think maybe that's what my call is today. Instead of researching the communities, I ask them how can they work within the system that is created to basically oppress them. How can we actually research these institutions to say, like, what can you do to stop oppressing people? What can you do to stop implementing policies that impact people's lives and create inequities across the city of Cincinnati? What can you do, University of Cincinnati? What can you do, the city government of Cincinnati? What can I do at Design Impact to say that what we're doing right now basically recreates inequities? We don't need to ask community how to stop institutions from doing wrong. We need to ask institutions how they can stop doing wrong. So I think that's one thing that I think we need to grapple with a lot more. And I think we can pull community in on that to say that, hey, come along on this journey with us and help tell these institutions what they're doing that leads to these inequities, as opposed to the other way around. So I'm going to flip it on its head.
You better preach. I'm like, go boldly, go loudly, make no apologies. I'm like, strategically, drive with the data. I'll walk through the door and I just keep it all the way real. Racism is impacting your outcomes. Here's the data, and we're going to move forward with the interventions that the people have asked for. And we're going to change things. It's very simple. Find your allies and your assets off rip. So it's like, go right through the door. Who are the people? Everybody at an institution is not an enemy. So who are your friends? And how can they spread the message to their colleagues at the top or wherever it is? But while all of that is happening, you're doing the intervention that the people have asked for. And at that same time, you are researching it to see if it is working. And data. I mean, there's no world in which you're looking at the United States of America and arguing that racism is not an issue. And so I'm like, we're not having that conversation. Instead, we're having a conversation about, so what do we do about it? Because I need the outcomes to change, not necessarily your heart. I don't need you to love Black people. I don't need you to love whatever. I need you to do differently so we can have better outcomes, because that is what the people deserve, period.
Renee or Ashley?
I was going to say, well said. I think that Meredith, Dr. Meredith, but and Dr. Webb, everyone has said the same thing. I think it said many similar things about the fact that we got to upturn the system upside down. And I think, Meredith, you spoke to the fact that, data is what's going to drive the conversation. So, I know when I talk in Cincinnati or when I talk somewhere in the state or somewhere else, I'm like, okay, so let's just look at the data. We're the 5th most segregated city. We've been in the top 10 cities in poverty for both adults and children for decades. So the data is telling us the story. So, and I think like Dr. Webb said, we keep being asked, like, what's the solution for us? I think we all know what the solution is. I think getting to the place of getting that system to respond to the strategies that I think each of you have presented and are probably presenting in your institutions and in your research. I'm baffled over the fact that we've been in this place we've been in the same space for decades. The efforts like Meredith's, why aren't they elevated higher? Why don't they have more resources? Why aren't they a best practice across how we change infant mortality outcomes for Black women? We know that the stress and race as a construct is one of the factors that contribute. So that's not going to all be steeped in only the intervention. It's going to be the structure changing. So I don't know. Back to the other question about social activism, I think it's the social activism that can get to the structural change that we're going to have, because I think and everyone that's on this call knows how to have the research inform the solution, but you've been researching, you've been engaging community, you've been telling and using voices and having the voices of the people drive, like, this is what's needed, but it's not changing at a higher level in the structure that causes the resources to come to where they need to be. And so, I'm very empowered myself by this conversation, and we have some incredible researchers in our community and who are doing the right things. But how are we going to kind of push up against that? And I think, Meredith, what you said, what you are doing around the data, but we all know the data. Like the data is not changing, right? So, and there are strategies that you know are working, but gosh, if those strategies are still limited to this much of the pie versus this much, we're not gonna get to the solution, as someone said in here, the solution. Like we know the issues. Dr. Webb, you keep saying we know the issues, we know the data, we know interventions that work. So how do you get those scaled up and funded in a way that it's really going to flip the script? It's going to change the conversation. It's going to change how that solution gets realized. So that's my. I'm encouraged that we can get there, and I think the data is definitely the way to get there. And so I'm very hopeful from this conversation and from all of the work that you are all doing.
And I was going to say, like, at the end of the day, you know, we talk about systems, and systems are made up of people. And I think we have to decide as individuals and organizations, what risk are you willing to take? Because this is risk-taking time. You know, this is not, I'm happy to be at the table, showing up, smiling, agreeing. Like, this is not what the challenges we're facing as a community. That's not what we need. So I think we have to ask ourselves, as community organizations, as research organizations, what risk are we willing to take as individuals and as organizations to create an equitable community? We have to be bold in our leadership. And until we're willing to take the necessary risk, until we're willing to be bold leaders, we're going to continue to be in these situations. And so it is about finding the allies, holding people accountable. Because at the end of the day, it is the people. And I want us to remember, because we talk about systems sometimes as if they're not made up of people. And so risk, we have to take risk. If we don't take, like, we think of, you know, it's a pandemic. None of us probably ever thought that you would live during a pandemic time. You do research, you've read the books, you hear how badly, you know, other disasters, you know, how we address them. We have a moment in time to really get this done and do it correctly in all facets of life. But we have to be willing to take risk.
Word. I also would add here, once you find something that works, you scale it, and then you create policies to sustain it. So like you get a little something that works out, and to Renee's point, then you fall off or you don't keep it pushing. And so I think that it's really important that we think about policy after we get the research, after we get the intervention, after people, you know, we find out what's working, what people have told us to do. And then we start working at the state level and at the federal level to make certain that whatever implementations we have or whatever the people have asked for is sustainable. Because I think sustainability is also a problem. In order to work yourself out of a job, you need to make sure it's sustainable. Yes. Mm-hmm.
Thank you all so much for your thoughts and your calls to action that you've given us. This is hard. In a normal setting, I would ask everybody to give you a round of applause. So maybe people can do their round of applause in the Zoom. But thank you all so much. I can't tell you how much I and the rest of the TCP team just so appreciate your input and the efforts that you're expending in your communities, but also to give this conversation about community engaged research the kind of grounding and necessary flipping the script that we need to hear. So thank you again so much.
Again, thank you to our panelists. Thank you to Dr. Conger for moderating that panel for us. We are going to allow for a quick 5-minute bio screen break before we have our next set of panelists. And as we've talked about what I like to call sustainable equity instead of blips of equity with our community research partners, I am super excited to have our faculty and our faculty researchers join this conversation to grapple with some of these issues that have been raised by our community panelists. Again, give them all a well round of applause virtually. My camera and my mic is on, so I'm going to do it for everyone here. Thank you all so much for your words of wisdom and for the work that you all do in our community. It is not, it's not going unnoticed, so we really appreciate you. We have about a 5-minute break here.